Hi there. My name is Amy Pearson, and I'm a resident physician in anesthesiology at the Mayo Clinic in Rochester, Minnesota. I'm a co-author for the article entitled Opioids for Chronic Pain, a knowledge assessment of non-pain specialty providers, published with Dr. W. Michael Hooten, Dr. Jason Eldrige, and Dr. Susan Moeschler, also of the Mayo Clinic, in the Journal of Pain Research. The number of prescription opioids in the United States has risen dramatically over the last 25 years, increasing from 76 million in 1991 to 219 million in 2011. With the rise in opioid prescriptions, the abuse and diversion of prescription opioids has also increased. Media outlets refer to this phenomenon as the opioid epidemic. As more than 40% of opioid prescriptions are written by general or family practitioners, these providers are often caught in the crosshairs of a challenging public health, medical, legal, and clinical conundrum. Primary care providers report concerns about medication side effects, regulatory scrutiny, addiction, and misuse. Many feel that their training on opioid prescribing was inadequate. However, we know that primary care providers who have received pain management education after their formal training reported the greatest level of confidence with prescribing opioids for chronic pain. To this end, our group wanted to quantify non-pain providers' knowledge and attitudes about opioid prescribing. We used a well-studied survey called the NoPain 50. The NoPain 50 covers all kinds of chronic pain topics, and at least 1/3 of the test is devoted to opioid prescribing. We used a cross-sectional study design in which we administered the NoPain 50 to 131 healthcare providers seeking continuing medical education about pain management. We included physicians, physician assistants, and nurse practitioners. A total of 219 healthcare providers attended this course, and 131, about 60%, completed the survey. You can see in the demographic data that physicians tended to be older, male, and have more years in practice, whereas the nurse practitioners and physician's assistants tended to be younger, female, and with less years in practice. The participants' scores on the NoPain 50 were recorded as total percentages. Subscores for opioid versus non-opioid questions were also recorded. Of the 16 opioid questions, 7 were characterized as medico-legal and 9 were characterized as clinical. These scores were also recorded and compared using two-sided t-tests. The mean score overall was 72%. However, the mean score on non-opioid questions was 74%, whereas the score for the opioid-related questions was 69%, with a p-value less than 0.001. In addition, the participants fared worse on the clinical type questions, with a mean of 67% compared to 74% for medical legal questions, p less than 0.001. Participants scored significantly lower on opioid-related questions. Of the opioid-related questions, the respondents scored significantly worse in the clinical domain rather than the medical legal domain. This supports the finding that knowledge about chronic pain in general does not necessarily correlate with knowledge about opioid prescribing. Based on these results, we concluded that it may be more beneficial to aim educational interventions for non-pain providers towards the clinical use of opioids rather than the medical legal aspects of this form of pain therapy. From those of us at Mayo Clinic, we thank you for watching and participating with us in this important discussion.